Okay, so a very warm welcome to this workshop, and I'm very sorry, apologies, my internet was giving me a little trouble, so I was not getting the OTP, so it took me a while to figure out, but yeah, so here we are. Hope you have all sort of gone through the other workshop and the presentations well. What we are going to look at here today is the social media and whether it can influence the policy and practices. Now, before we actually know whether social media or answer that question, whether social media can influence policies and practices, I think we need to kind of reflect back a little bit to kind of think about our own engagement on the social media platform. So I think before we actually go into the details of what happens and how it happens and what's the theoretical background and why it can influence the policies and practices, I would like to, so I will need a little bit of a hand from the chair there in the session as well, just to pass on to me the questions, because I won't be able to see that on my screen. So if we can, you can also talk to me as well, because this is more kind of a workshop where we start doing a few things as well before we actually go into the main point. So if I ask you, why do you use social media? And if I start with myself by saying, well, I go into social media to seek information, so I'm not always readily available on social media, and that's part of digital literacy as well, because when we use social media, we tend to spend more than we actually intended to initially to go onto a platform, whether they be Instagram or whether they be WhatsApp or they be Facebook. So whichever medium you are using, can you give me a sentence or two just to say, why do you use social media?
Hi.
Right.
Maybe I can say that to express myself to people and also get to know what people, I mean, general updates about friends, and also get to know what they are doing in their life currently and what do they think about a particular um event or anything. So nothing in general as such to actually know what is happening around the world, but basically to connect to people.
Yeah, so I think that there are two things happening here, isn't it? One is that you are, as a social being, like we all want to connect with each other. So that's one of the things where we want to stay connected. The second thing is that you also go there to kind of seek information and kind of trying to understand what others are doing, so that you can reflect back on your own life as well. And this is the main criticality that we look at while we are on social media platform, because myself, with my background in digital media and society, and as a digital anthropologist, I'm kind of particularly interested on how people behave. So on social media, what you said there is kind of very important, because on social media, we tend to kind of not only just connect with people, but also observe what people are doing. And those observations have got a direct impact on how we think, because, of course, we had some, and possibly you guys will also have that kind of interaction where we tend to look into people when they are on holidays and how well they have spent their time, to if we look back in our lives and we think, well, we have not spent that much of time, and maybe we have not gone for a holiday for a long time and all of that. So it's kind of it starts a vicious circle of thoughts, and that vicious circle of thought can have an impact on how we think and on how we receive information. Because a person, when they are, like you said, that you like to post things on social media as well, to kind of maybe to connect, but also to kind of share your experience on social media. However, when you are posting it, you have got an intention in your mind, which we call encoding. So how you encode a message on social media is not going to be the same when it's received by someone. So when I am decoding your message, I might decode it from my own context, which might be quite different to when you posted it, and the idea or thoughts that you had while you were posting it on social media. So the encoding and the decoding bit on social media is very important, and kind of is an area which differs quite a big way from traditional platforms, because on traditional platforms there is less and less user generated content, although there is an interplay happening between the user generated content and how news are being made on traditional media platforms. But I think fundamentally social media is quite critical in the sense of how we use it, but also when we use it, we are not conscious of the fact that there are lots of eyes watching us, which we call web crawlers. So the computer scientists, they design algorithms, and of course these web crawlers kind of move around, and they try to pick up on your behavior. And you will see that when you are watching something on your Facebook, you will see some adverts coming up which links to something that you have searched for on the internet. And those are the kind of connections that happens behind the screen, which some of us understand, some of us don't understand because we didn't want to dig deeper. And all of these are also fundamentally linked to the digital literacy. So many people who use Instagram, social media, various kinds of social media, whether they be, photo related social media when we look into Instagram, or they be more kind of interactive social media platform where you talk and you can post a lot, like Facebook. These are all social networking sites. So all of them actually have got those kind of mechanisms. Now, that's where the question of media interventions comes in as well. So in traditional media interventions, it is very much crafted around what you want to show to the public and what you want them to think about. And those kind of traditional media interventions can be designed by using different kinds of frameworks or different kinds of theories in media, which I will come and touch in a minute. But media interventions, traditional media interventions, do again differ from planned media interventions. Now, if I go back to the media intervention in general, then you will see, so say, for example, government in certain countries or in all the countries have got their own agenda, and the government houses, of course, and the local or regional governments, along with the national governments, they work quite closely with big media houses. So imagine the time when there were messaging around how you protect yourself against the pandemic. The first thing that was rolled out in the media was very much about a threat on the economy, because the government was protective and they were trying to protect the economy, but they also wanted to get that buzz out into the public. And how they can get that buzz out into the public is actually through the media. So most of the media framing, if you notice, started with the impact that the pandemic will have on the economy. Then it shifted gradually to more kind of social frames, so looking into how that's going to impact food crisis in a country or poverty in a country, or how that's going to impact mental wellness within a country, and also the framing. When we look into the media intervention framing during the pandemic, you can see two of the framing coming out more prominently. One was the societal framing, and the other one was the medical framing. And you can separate them out, because when it was the societal framing, they were talking very much about social problems and how the pandemic is impacting it. The medical framing was very much around the virus, the name of the virus, the spread of the virus, the way it can impact, and also about the medical interventions. Now, this was designed in a way where the traditional media basically worked very, very closely with the government. Whether you take the example of New Zealand or whether you take the example of Sweden, compared to Taiwan, or if you look into other countries like Sierra Leone as well, In some countries, these traditional media platforms were actually used to minimize the gap for digital for educational purposes, and these platforms were actually used by the government to reach out to the public as well, while providing them with some adverts. So the interventions were quite tight, and if you look into the pandemic situation, that's what we will call a planned intervention. And a general form of media intervention actually happens all the time. It's kind of whether you are talking about the economy, or whether you're talking about about the market, or you're talking about general problems that we have, whether they be around a regional government. They want to get their message out. But the planned intervention that we saw during the pandemic was kind of an intervention that the government wanted, but at the same time they wanted the public to behave in a certain way, and therefore it was very closely monitored. The purpose of media intervention has always been to inform, to persuade, and to motivate. So the information that went out to the public at the very beginning, sometimes that goes out as a public information model. And that public information model doesn't have people's responses back into the system. It's a very much one-way communication that happens. Moving on from the information section is more kind of persuasion, where there will be more kind of emotionally coded messaging going out to the public. And that might also have some kind of storytelling that tells stories about particular people within the society, or particular evidences around things happening within a hospital situation, if you look into the pandemic situation. In case of, if I give you an example, in case of the mental health and mental wellness, you will see that those kind of messages, first of all, the traditional media are very much interested in showing or evidencing things that has got a wider impact, like suicides. So you will find a lot of sensationalization of news on the traditional media platforms that tries to inform the public, but also persuade and tell a story that's very much emotionally driven. And in a way, when it comes to the motivation, in case of pandemic, the motivation was for people to kind of act and behave in particular manner. So using a mask, or they were looking for people to kind of, adapt to the social distancing. However, when you're talking about the suicides, the motivation can be both positive and negative, because someone who is living in that situation might be driven by a very negative motivation towards how they can do it. So they can learn through the story. And therefore, it's very important, like when we are dealing with different kinds of situations, how we actually inform, persuade, and motivate, which is difficult to control when it comes to our traditional media platforms. However, in all of these, you will see that not particularly related to the health-related interventions, but any kind of interventions on media, you will find that there are three theories that's operating in the background. One, there is an agenda-setting function of the media, so what you want the public to think about. And if you want the public to think about in certain light, you have to frame it, yeah? So this framing, if I give you an example again from the pandemic times, you will see that in UK, the framing actually changed, and it was color coded. So from the very beginning, there were four colors that were used consistently. It was the yellow, it was the green, blue, and red. And all of them had some underlying messaging through the color codes that was going to the public. So, where you were said that you have to stay at home, it was a red messaging. So all of those color coded elements that went into the press briefings were actually part of the media framing. And again, this is how the media and the officials or the government houses, they kind of work together, kind of think about how people will perceive or how people will decode that messaging when it goes out to them. And the other one that was also used was the cultivation theory, which means that the more you show people, so the consistently you show people the same messages, people will tend to receive that. And even, and it kind of says that after 10 times of repetition, it kind of retains in the brain. Now, when you are working on a health-related intervention, what we tend to see is that the agenda setting, the framing, and the cultivation works very well when you have got visuals rather than texts. The visuals tend to impact and have a cognitive appeal on the population, but also on policymakers, because it kind of portrays or it tells a story. And visuals are very important when it comes to health-related intervention. So you will see whenever a health-related intervention is reported, if it is around the pandemic, you will have a visual of either an oxygen or a whole hospital setup, or the nursing or a team helping out as paramedics. In case of mental health, you will see that there will be either a very dark sort of picture that's gone out, or you will see a very hopeful picture with a background showing something. So oftentimes it will be a sky, or it will be a glass depicting that you can see through it. So depending on how you are framing it, people who are decoding it, they will get it. Now, how does that work in action for media? Of course, in media advocacy is one of the elements. Now, all of these are blurring now because of the social media, and we will come to that in a minute. But particularly when you are looking at media in action, you are looking for media advocacy. That means you are looking into the newsworthiness, the perceived reality, and communicate saliently. So these are basically the three pillars upon which the media advocacy function performs, I would say. However, all of that is changing because of the social media. Now, whatever I have said there, if you look into the social media, do you think, if I ask you to do a little bit of a reflection and think about, does the framing happens in social media? Does the agenda setting function of the media that we have seen, is that still operating on social media? Does the cultivation theory operates on the media? So if I open this up at this point for a general discussion, just to ask you what you think when you are on social media, what's the agenda setting, or what's the framing, or what's the cultivation thing that has come to your mind? Can I have some responses? You can talk to me, or you can write in the chat as well, and I will need a helper to pass me on the messages if you have anything on the chat.
Dr. Indrani, we have time till 1:55 BST.
We have time?
1:55 PM BST. We can take the break time.
Okay. Is it a break now?
No. We have break from 1:45 BST to 1:55, so we can take that time as well. Since we were not able to, you were having some network issues, no? So we can take that time as well, break time.
Oh, okay. Yeah. Thank you. That's really helpful. Yes. Yeah. No, that's great. Yeah. Okay, so for this one question, have you got anything in the chat that you can pass me on?
Yes.
Okay.
Ma'am, can you please repeat the question, if you don't mind?
The question is like, how we looked into this one, the three underlying theories of agenda setting, how media sets an agenda for the public, how then it's framed, and how you kind of show the same messaging time and again on the screen, so that people can actually people then start to kind of believe that message. So do you think these are operating on social media as well, from your own understanding? Have you seen them functional? Do you think that on social media you have seen that there are some agenda being set, or there is a framing, or there is a cultivation happening? And you can think about blogs, you can think about social networking sites, interactive sites, and mobile applications as well.
May I answer this?
Yeah, definitely.
I mean, in my experience, it does happen all the time. Like, if you search for a particular topic, like, if I want to look at what about the mental health of youth, say in the USA or in Canada, and if I search for that on one platform, then it appears in some other platform when I'm looking for something else. It pops up and it kind of invites you to read on that more and more, and then you kind of get so much into it that you want to know more. So
Yes.
that happens, and that is how it affects. I mean, unless you're aware, you know where you want to stop, but otherwise it might affect adversely.
Yeah. So what you're saying there is actually, the deluge of information that can actually not give you the information that sometimes you are looking for, or actually take you to somewhere else as well for looking for like more wider information. So if you don't know where to stop, you start on struggling between finding the right information. But what you are saying there is interesting, because what you're saying there is about the search engine optimization function of the internet. So when you search something on the internet, say for example on google.co.uk, then you can find that there is something called there are something called nodes that operates, which means that if you search for, say for example, the pandemic, you will see that there is a oops. Can you see the things also coming in?
Hello.
No, ma'am.
But the notifications coming in as well.
Yes.
Hello.
Yeah, hi.
Yeah, ma'am, I just want to share something. I don't know
Yeah,
whether this is right. So, what I observe mostly is like whenever there's some government policy that's coming, like the new education policy, or maybe the mental health care act, or any such thing that comes up, so immediately, or when the budget is being presented, so what happens, I feel, is there is some sort of framing that happens.
yeah,
Some group that talks in favor of the budget, and some opposition group that talks only about the flaws in it. And mostly the channels or the networking sites that support the either of the parties, they would project either positive or negative images related to that, or related to the party, or related to the leader. So I
yeah.
don't know whether that relates to this. They set an agenda, then they frame what kind of information, and then they project whatever is in support or favor of their own leaders or parties. I don't know whether this kind of correlates to it. This was just my thought.
I think it in a way correlates. So how what you're saying there is very much around the notes that I have here just made. That what you're saying is that when you have got a political agenda, then you tend to pursue that political agenda through the media. Is that what you're saying?
Yes. So actually, the policy or a budget is being presented, but simultaneously, the media takes a different stance. They tend to frame something, positive or constructive related to it, and at the other end, they talk all about the disadvantages of it. And again, the images they portray, or let's say the advertisements they show, or the pictures they show, or the way they try to project either of this, positive or negative. That is what I wanted to tell.
That's right. So I think the framing, there are two things. One is that, in media, in traditional media, you will see negative news is a big news, we say. And negative news in the big news is because that's, when people are drawn into both positives and negatives, but you will see that there is a general tendency of people being drawn into the negatives more than the positives. And this is the very psychological element that media plays on quite a lot. And we talk it in the perspective from the social psychology perspective. So when, say, for example, a government places a budget, or there is a news announcement from the budget, from the government side, you will see that that's being received very positively by some press, and some positive and very negatively by some press, or that's being framed negatively or positively by different press or media houses. And this is the fun game, because some media so this is a polarized system that you're talking about here, and that's the problem of the traditional media, which doesn't happen on social media. So some media houses, they work with the government, some work against the government, and there is a certain element of polarization that's being floated into the media, because of course that's part of the political system or the societal system. And therefore the polarization of media is sometimes, it's very hard. So if you ask people that, okay, you are the supporter of the national government, and what are the newspapers or what are the sites that you look for, you will see that they have got an inclination for a particular site. And when they're talking about, say, for example, people who doesn't like the national government or doesn't like a regional government, you ask them and they will talk about certain press or certain media houses. So this, what you're saying, was kind of is part of the polarization of media. But what we are talking here is very much around the cultivation and media, and how media houses frame certain things, or they set the agenda around health intervention. So when we are talking about the health intervention, so just moving on from, but it's a very interesting one that you kind of brought in, because it kind of links to what I'm going to say now around social media. So say, for example, on social media, although it seems like there isn't a agenda setting function of the social media, you can still see that agenda being set at some levels when you're writing blogs or when you're browsing through the blogs. So again, what I said there was how you frame something within your blog, or what you talk about in the blog. It's not that the blog is only witnessed by the general population, but blogs get picked up by the government, people in the government as well. And if you look into the blogs, you will see that the blogs hint towards certain things. So I have come across blogs during the pandemic which was supporting the initiative by the Swedish government, because the Swedish government was very much resistant in using the masks. And the reason they were actually resisting using the mask was because, was because that they had a kind of, because they wanted to, the message was very much around that you have got what is called the, I lost it there. It's the mask one, yeah. So the message there was,
Man, there is some noise. Maybe. Hello?
I found this on the web.
Can I just 1 minute take the call?
Sure, ma'am. Please.
Because it's not going off, so I'll just...
Yeah, please do.
Sonia, I'm still in the conference. I'll just join you in 10 minutes. I know that it's, just starting off, and I'll just call you back. You can carry on, okay. Yeah. So what I was trying to say there is that, in some of the Swedish websites, what you will, some of the bloggers who were supporting the Swedish narrative, you could see that that they were actually talking about not using the masks, because what they were saying is that the pandemic, if you're asking people to use the masks, then you are saying that the virus is airborne. And you can see lots of blogs around that, actually. That was happening mostly in the Scandinavian countries, in Norway, in Finland, in Sweden. And those were the blogs that then got picked up, of course, by at governmental levels, but also across borders, and that's the thing. When you are setting an agenda, when you're trying to set an agenda, there will always be a counter narrative that you can't find in the traditional media. And that's what sets in the independence element within the social media. And then there are these social networking sites that basically helps you to build that narrative. That means that you are talking to people, you're interacting with them, and you're trying to make a sense. So from there, what the New Zealand government learned from what the Swedish government was saying is that when you're asking people to actually stay at home, you need to not just mandate them, but you have to also tell them that while you are staying at home. So you're staying at home to break the chain, or you are using the mask to create a barrier so that you don't have, you're not actually putting your hands on your mouth and that kind of thing, without washing them. So part of it, what the social media has brought in, is that if you are framing it in the context of the public, then you have to provide them with the information on how you want, why you want them to take an action. And then from there, from the social networking sites, you have got the interactive websites as well. So say, for example, you are posting something on your website and you are actually not providing people with a space where people can come in and chat with you or interact with you or ask you questions. So if you don't have the chat function, at least you're providing an email for people to get connected, or at least you're providing them with a mobile telephone number. And that's what makes the difference between a social media and the traditional media. Traditional media has got less power to influence policies and practices because it's a one-way communication where they are telling you what the story is and what you need to think about. In social media, it's an interactive one where you are going to a cognitive experience trying to make sense of a person who is positive and to a person who is negative. So that's what makes it different, and that's what it makes it much more easier to influence the policies and practices, because you don't see one angle of the story, you see both sides of the story. Coming from there to the mobile applications, which is more kind of integrated in the websites, I would say that that's again something that we have looked at, particularly during the pandemic time, where we have seen that this integration has been very helpful, where we have got a website that's telling about the germs journey, say for example, to when you have got some mobile applications where children can actually learn what are the different steps through which you can wash your hands. So you kind of you're not just telling them, you are actually showing them, you are actually going through a journey with them. And this can have a very positive impact on policies. We have seen these kind of interactive mobile applications and interactive websites having an impact on the policies and practices, particularly in the education sector, but also in the health sector. So how the hospitals have then started using these kinds of applications, which is a virtual reality application or artificial intelligence embedded applications in their hospitals, to convince or to kind of educate the public within that setup. So moving from there, the perspectives that you are also bringing in on social media is not just one perspective. So there is not one media, one government, but there are different perspectives coming in. Public interacting with the content that you're posting, patients interacting and bringing in their own experience. And then there are health professionals, they also join and they kind of comment on what's right and what's wrong. So these are the kind of things that make social media much more valuable to kind of interact and talk about. And what we have seen, because that there are three perspectives, we have seen that the decision making, the exposure to the disease or the risk behaviors, the people's perception of it was very much shaped by the social media. So in some settings where people were not using the mask, I've seen WhatsApp messages saying, well, we have been in this place and people have not been wearing masks, or we have been in the supermarket, so the supermarket needs to actually take action. And as a result, Tesco then has come back saying, we have taken actions and we have said this and that. So people without a mask is not going to go into the shop at all. It's not an independent decision, but it's if you want to shop, you have to wear it. So we have seen these decisions have become much more, making more easier decisions by the corporate houses or by the government or by other policymakers as well. And I think that there is a learning journey that we have gone through when it comes to social media, because in social media, the best thing is that it's very independent. You've got this user-generated content. You can share your own story. And that story can make a difference to the world. There is also the problem of misinformation. There is the problem of conspiracy theories. However, a recent study that was done on, I think, 8 countries showcased that although the conspiracy theories were talking about the virus, talking about the vaccine uptake and all of that, but that had a very minimal impact at the ground level. People still relied very much on the social media when they were communicating, particularly the age group of 18 to 24. The 18 to 24 during the pandemic time, they kind of interacted more on the social media rather than on the main news media portals. Countries, they searched for news and search for instructions cross-border. Yeah, so people who were trying to access news and try to learn about the virus in Brazil actually accessed news media, the social media platforms and the websites in UK and US and in India. So it was kind of it's a kind of a very, very silent revolution that we have gone through. If we have noticed, many of it has got unnoticed. So we are kind of now going through that research to understand the behavior and the patterns of behavior that's emerging out of it. But we think that the user-generated content, although they have got risk, but they have kept us informed more efficiently than our traditional media. And they have influenced our policies and practices. So if you look into Instagram, and if you go into Instagram searching for mental wellness, you will see lots of good social media and bad social media habits floating around on that platform that have actually educated us. And I think that this is going to be on a next level where there will be more checks and more interventions before actually the information goes on the social media platform. However, that's something definitely that we are looking for there. Okay, so moving on from there to the next one is, of course, as I was saying regarding the Instagram, you can find that there have been lots of good tips around good mental health and all of that. So so I think what is fundamentally happening there is that you have got social media actually gives you a platform where you can come and synchronize your ideas. Then you can coordinate your actions. So say, for example,